Okay, so the video on detox was longer than I had the intention. And so this one will be short and sweet. So, in this month of October for breast cancer awareness, as I said yesterday, I chose to do some just small, giving you small bits of information of what you can do to promote breast health and prevention. And other than just checking and making sure you don't have nodules, fibroids, doing your self exam and going for specific studies of the breast, there's a lot of things you can do to prevent. And so one of the things that I mentioned at the beginning is that there's a couple of specific nutrient deficiency that will be right, like directly linked to breast cancer and breast health in general. And one of them is vitamin D. Vitamin D deficiency, like if there's one vitamin that you should make sure you have the right amount of for cancer prevention, your most important vitamin is vitamin D. Vitamin D is activated by the sun exposure. Um, I could talk long about vitamin D too, but let's just stick to that and say that we recommend 50 to 80 nanogram per milliliter year round for prevention of breast cancer, for example. And that's something that we want to do. And when we work with cancer patients, we even try to bring them above 100. And you would be surprised because people say like, oh, it's the sun, vitamin. I live in Mexico, for example, and you would be surprised. And when we run lab tests, a lot of our Mexicans would be under 30. And it's like, what? They're not in the winter, like fully dressed up, they're exposed. But you know what? People work. And not that many people at peak sun exposure are outside, half naked, making sure they get the right amount of vitamin D. The thing with vitamin D is that as soon as you put an SPF sunscreen, you block that activation. And so what I try to do personally is take a 10 minutes. It doesn't need to be long, but at 10 minutes, just being exposed to the sun, try to uncover the less exposed area. If you have a darker color skin, you need to be a bit longer to get the same amount as a really white, reddish person like me. And so 10 minutes is enough. Then I put the sunscreen on. So that's just a trick. But ideally, it's when the sun is at its highest point in the sky and uncovering those areas that tend to be covered. No, that's ideal. When people live in areas where there's less sun exposure, there's lamps that exist that will stimulate the same release of vitamin D. And I've even seen some patients that when they would only take supplements, it would still not change, and they really had to use the lamp to activate their production. We can say production of vitamin D. One thing that can be seen with vitamin D deficiency that will happen with people with really low cholesterol. So, anti-cholesterol medicine has been trendy for a long time. I've seen sometimes um, good intentioned doctors give anti-cholesterol medicine to their patient, thinking that the lower the better. I think now knowledge has shifted. I don't think that's done anymore. But one problem with that is that when cholesterol is too low, then you're not producing, you lack the structure of vitamin D is cholesterol. The structure of the structure of all your hormones is cholesterol. So you can start having other health issues when your cholesterol is too low. One cause for low cholesterol would be liver toxicity. So if you do what we spoke about in the liver detox video I did yesterday, That can help making sure you have proper levels of cholesterol. If you have questions about this, you can write it. Again, it's more extensive. I'm trying to put it really simple, really easy to understand for normal everybody, normal people. So this is one thing with vitamin D. Like, make sure you have good levels of vitamin D for breast health. The other nutrient that we really need to look at is iodine. Iodine deficiency is an issue. It depends where you live. Like, I live on the coast. We the soil here is richer in iodine because of the sea salt. So it's not as much an issue here. But if you're around the Great Lakes area, for example, there's not much iodine in the soil. That's one place that's documented, no? So, like, just that's one thing to consider. And for your breast tissues, to prevent fibrocystic breast and cancer, you need 20 to 40 times more than what is needed to prevent goiter. So people know that, oh, like, like, if we talk about old times, like when somebody would have a goiter, which is an enlarged thyroid, they would say, oh, iodine deficiency. Well, you need 20 to 40 times more iodine just to make sure you're to prevent fibrocystic breast disease and cancer. So obviously you can find iodine in seashells. Ideally, I supplement to make sure that I have the right amount of iodine, and I use sea salt that has not been fluoride. I don't know if that's how you say it in English, but with no fluoride, that has not been bleached. So, like, the closer to nature, the better, so that your salt still contains some iodine. And I use supplementation. So those are things that you can do to prevent breast cancer and make sure your breasts are healthy.